Well, welcome to this workshop. We are going to talk all about pelvic organ prolapse. So, if you've ever been diagnosed with a pelvic organ prolapse or you've recently had a baby, this is going to be really a great conversation because we're going to talk all about how to get back to the gym safely with your pelvic organ prolapse and how to not make things worse. So, welcome and thank you for being here. All right, let me just make sure it's just me up here. Oop. Perfect. Okay, so here we go. Let's talk about what symptoms of a pelvic organ prolapse are. So you might be listening to this because you have heaviness, you feel heaviness in your pelvis, you feel pelvic pressure. You might notice that something's bulging into your vagina, or you might feel like you have something in your vagina, like you're just standing there and something is just lower, and like maybe a ball. I've heard it described as a ball in your pelvis, or feeling like something's not in the right place. Having a pelvic organ prolapse can also give you symptoms of deep ache. So it can be discomfort. There can be pain with intercourse. Queefing, also known as vaginal noises, is very common with pelvic organ prolapse. Sometimes people notice this in yoga. So they're doing a downward facing dog and they change positions and all of a sudden some air is trapped and they queef. And maybe that is enough embarrassment that they don't go to yoga anymore. It's one of the common things we hear. Or group fitness of any kind, doing sit-ups at Orange Theory is one of the things that we also hear. Frequent urinary tract infections, urgency with urination or defecation can also be signs of a pelvic organ prolapse. Their difficulty initiating the stream of urine, having trouble emptying your stool, or even dripping on the toilet seat. That can be one of the symptoms as well. So it might be one of the first things that someone comes to us for. They're just like, every time I go to the bathroom, I see some drip on the toilet seat and I don't know how to get rid of it. So we'll talk about how to manage these symptoms, okay? And I'm just telling you what they are, but since you're already here, you might know what these symptoms are. Okay, so then we have your urine stream might spray all different directions. That can be a sign of pelvic organ prolapse. And then again, the lower back pain, hip pain, or pelvic pain can also be symptoms. And so there's no consensus on how many people in this world have pelvic organ prolapse, but from a clinical experience, I will tell you that every single person that I have assessed postpartum always has some descent of their pelvic organs, so some descent of their bladder, uterus, or rectum into the vaginal canal after a baby. Now, a lot of times that heals and goes away, but a lot of times people aren't necessarily here because they think they have a prolapse. They're here for their diastasis or something else. And we check their pelvis and we're like, okay, there is some degree of prolapse here. So let's work on it too. And the reason it's really important to identify is simply just so you can do the tips that we're going to talk about later. You want to be able to incorporate those tips into your life so you can manage your prolapse for the rest of your life. If you don't manage the prolapse, it doesn't mean that you're going to feel it, but eventually, maybe it's menopause, maybe it's when you decide to train for a marathon, maybe it's when you decide to go back to CrossFit, whatever that is for you, whenever you change your activity level or change your hormonal status. Maybe it's when you stop breastfeeding again. You could notice a change inside of where these organs are. So, or you might notice the symptoms. And when those symptoms start to happen again, then you want to prevent them from getting worse. So that's why it's so important to have these techniques as you go back to exercise to maintain the position of your organs or to help them go back to their places, because they don't get better with menopause and it doesn't just go away if you ignore them. And so we want to keep that in mind. Okay, so I wrote down 80 to 90% of postpartum patients experience some degree of pelvic descent, which is diagnosed as a pelvic organ prolapse. So let's go to the next slide. Here we go. So here are the different types of prolapses that we're going to talk about. So you have a cystocele. So this is where the bladder, here we go. This is where the bladder can descend into the vaginal canal. So this is gonna be the vagina. Let's pretend this is the vagina. This is the front of the vagina. So where your vulva is, this is the back of the vagina where anus is, okay? So back wall, front wall. And so your bladder is gonna be here. Your uterus sits on top of the bladder, then your rectum is behind it. And then this is the vagina, okay? If you have the front wall coming into the vagina, that is called a cystocele. And so that's shown in this picture here. You see in that second picture, the cystocele, that big ball of fluid, empty ball that sits underneath the uterus is falling into the vagina. Okay, so that is a cystocele. A rectocele is when the backside, the rectum, is falling into the vagina. A uterine prolapse is when that cervix is coming down into the vagina. And then a urethrocystocele just means that the urethra and the bladder are coming into the vagina. And then perineocele and enterocele are a little less common. Pterocele is small intestines coming in to this pelvic cavity and like into the vagina. And then a perineocele is a little bit more complicated than that. It's when the central tendon of the vulva. So here you might have like a bulge down low, kind of closer to the rectum. So it's not necessarily that something's coming into the vagina, but you would still feel a significant amount of pressure. Okay. So those are just the diagnoses. That's what like a pelvic expert physical therapist or a urogynecologist is going to really look at to identify what part of the body is shifting into areas that it's not supposed to shift. And then they'll provide a diagnosis. It all doesn't really matter as long as you can treat the symptoms and help it feel more asymptomatic. So the goal of treatment with the pelvic organ prolapse is to get you to live a full life. It's to get you to a point where you're not scared to exercise, you're not scared to do anything because of your prolapse, and all you do is manage it and you manage the symptoms. Now, postpartum, initially, there is some good research that those prolapses can significantly reduce within the first 18 months postpartum. There's some good research on that. But, as far as like changing the actual positioning, it all depends on what's causing the pelvic organ prolapse. And there is some research that shows like a genetic component. So if you have more flexible tissue and extensibility or flexibility, then you might have less of a time helping your organs recoil back into their position. But that's okay because it's all about the symptoms. We want to manage symptoms. If you're asymptomatic and you have a little bit of a prolapse or your bladder's coming into the vagina a little bit, but you can't feel it and you're not peeing your pants and you're not pooping yourself and you're not having pain, then that's all great signs that, you've managed the symptoms and now you just have to do the moves, we're going to call it, the moves that we're going to go over in order for things not to get worse. Okay. So the fundamentals to how to manage a pelvic organ prolapse and really healing a prolapse without surgery and without injections. We're going to go through here. Of course, that piece a part of it. So the reason it's important to manage this stuff is some people will go in for surgery to fix their pelvic organ prolapse, and they might do a sling, right? A mesh sling or some other form of surgery to correct the prolapse because they're feeling incontinence or something else, whatever their symptom was. And then they fix it and things still aren't better. Or 10 years later, the surgery fails. And the reason behind that is because the root cause of what is making that prolapse worse is not being addressed. So what we talk about here is absolutely essential in managing, excuse me, I dropped my part of my rectum and my pelvis that I'll show you about. Part of like managing all those symptoms and managing this prolapse is going to be addressing these issues. So if you just go on to have surgery and you don't address any of these issues, most likely that surgery is not going to be successful because of this. And I think that's the number one reason why pelvic organ prolapse surgeries or corrective surgeries for incontinence the success rates are so low, and the failure rates are very, very high of these meshes. And the reason for that, other than the body rejecting some of them, and there's been lawsuits upon lawsuits on that. So it's important to find a surgeon that, is really good and is skilled in this, but is because we're not addressing the root cause of the pelvic organ prolapse. And you can't have a prolapse just because you push for hours and hours. And that's absolutely what causes a lot of prolapses. But managing it and helping that heal is important. Chronic constipation can cause a prolapse just because of the constant straining that you do on the toilet. So these are just things to keep in mind. In my biased opinion, a pelvic expert physical therapist is the most essential team member, like in your healthcare world, to help you heal this prolapse. So I'm going to talk about like what these tools are and really what a skilled pelvic expert physical therapist will do for you. And it's not Kegels, and it's not just slapping biofeedback on you, which are these little electrodes that teach you how to contract and relax your pelvic floor, because it's so much more than that. And that's why it's important to talk about that today. So one of the things I'm going to talk about here is tone. Then we're going to talk about bowel health. Then we'll talk about breath patterns, core coordination, and strength. All right. So these are simply important regardless of whether you have a pelvic organ prolapse, because this is kind of lifelong health of your entire pelvis and core. Okay. So yes, I'm talking about these in managing pelvic organ prolapse, but these are just simple management tools for a healthy pelvic floor for the rest of your life. Okay. And so tone is important to talk about. So tone of a muscle. Okay. So here's my bicep. I'm going to just demonstrate this first. So go ahead and look at me here in the image. So here's my bicep. When I contract my bicep, it bends like this. My elbow bends like this. When I relax it, my elbow extends like this. That allows me to carry groceries, pick up my kids, brush my hair. But if I live in this contracted state, then we're going to have a problem, because then I don't know how to relax. Okay. So and this is where most people are living. And yes, that's where most people are living, even after they push a baby out of their body. Because if you have any trauma to this area, so you just pushed a baby out, you're going to get some scar tissue. And what does our body do around scar tissue? It contracts around that scar tissue. Okay. And for any other trauma, our body's going to contract around it. Any stress in our life, so regardless of whether you've had kids or not, you're going to have a more contracted pelvic floor, because our pelvic floor is very related to our autonomic nervous system and that stress response. So when we're experiencing stress and anxiety, most of the time our pelvic floor is just rock solid and contracted like this. Okay. So the problem begins is if we live our life in this contracted position. When we go to pee or poop and we are trying to get stuff out of our pelvic floor, we need to be able to relax so the pee can leave our body easily. When we go to push a baby out, we need to be able to relax and open, overextend so we can push the baby out. When we go to poop, we need to be able to open so we can push the baby out. Same thing with farting. We need to be able to open, to relax, to fart, to pass gas. Okay. And so if we're unable to do that relaxation move, or if our relaxation move only brings us to here, what happens when we go to have that bowel movement or push the baby out is we have to generate a lot more downward pressure, like the pressure, in order to get the stuff out of our body. Okay. You typically won't just sit there and relax and hope that everything leaves. Or if we're sitting there and relaxing, not everything will leave on its own. So this is when we talk about tone and the importance of managing tone. And so if we're in this contracted position, the number one thing you have to learn how to do is relax the pelvic floor. Now, many people don't believe this or aren't teaching this because they're teaching Kegels. And if you're already in this position and then you're Kegeling on top of that, or doing exercises to strengthen your pelvic floor on top of that, maybe you're sitting on these chairs that are now popular that strengthen your pelvic floor. The answer is not to strengthen the pelvic floor. The answer is to relax these muscles, and then you can contract them and relax them. And that's a functional pelvic floor. Okay. That's what we're aiming for. We're not aiming for this more contraction and squeezing to hold things up and in. That's absolutely not what we're going for. We are going for this full range of movement and relaxation. The more we are contracted and tight, the more we're going to have pelvic organ prolapse and descent. And what we typically see is that, so here's vagina again. If you have the bladder coming into the vagina, and then you go to squeeze and contract your pelvic floor, you might just make it worse because you're kind of squeezing the organs out of your body. Okay, so it's really important that you learn how to relax your pelvic floor before you start exercising, so these organs can sit in their nice places. And then it's safe to do whatever you want to do for movement, because usually movement is going to cause some contraction of the pelvic floor, or a Kegel, if you will. But you don't have to isolate and just think about doing Kegels. We don't prescribe that. We don't recommend that. That is the cause for a lot of dysfunction. And in fact, we carry Kegel weights here, and we never once sold one of them, because of the fact that like most of our patients and clients don't need Kegel weights. They need to learn how to relax their pelvic floor, and then can work on the strengthening aspect of their entire body. And that alone will get overflow to the pelvic floor and allow you to manage this prolapse. So I hope that is clear. And you can always ask questions or send us a message if you want more information or know that this is what's happening to you. So managing tone, number one. Number two is bowel health. So when we talk about bowel health, we want to make sure we have healthy, happy bowel movements. When you have a baby, your colon is way extended and out to the side. So our colon goes in this position. It starts, so this is my left-hand side, okay? This is my right-hand side. The large intestine or colon starts over here at the cecum, comes up, goes across to the transverse colon, and then we go into the descending colon and to the sigmoid colon. Now, when we're pregnant, this gets pushed out to the side. We want to rebuild our core so the organs come back together. But we can do a lot of techniques as pelvic expert physical therapists to help those organs shift back into the right place. And then when they do that with our organs, we need them to maintain good motility, it's called. So that's when the organs kind of move independent of your breath inside your body. Okay. So if they're moving inside your body, that means that you're going to have good peristalsis. So you're going to have good bowel movements on the regular basis. Constipation is not diagnosed until you can't have a bowel movement every 4 days, but we want you to have a bowel movement every day. And the reason we want you to have a bowel movement every day is because we want to take the pressure off of the pelvic floor and make sure that you're not getting like a backed up full colon isn't pushing down on the rest of the organs, making it look like you have a pelvic organ prolapse. So managing the bowels is really important. And chronic diarrhea or chronic straining or pooping all the time can also, just like that chronic downward force, can make things worse as well. So I'll just show you here. So we have vagina here, okay, rectum here. Okay, if I go to the side, again, you're going to see rectum in the back, vagina here. All right, how this goes, I hope it's really hard in the bladder or in the pelvis because it's all 3D. I lost part of my rectum here as we were talking. But so then this is vagina, that hole in the middle. The bladder's in the front of the vagina, the rectum's in the back. We kind of talked through that. And so if the rectum is really full, so imagine like all, you don't want to imagine that, but stool compacted heavy on these organs, it's going to push things down through the vagina. So the number one way to manage your prolapse is to make sure that you're having a bowel movement every single day. And so you might need to work with your pelvic expert physical therapist to figure out, okay, how can I get my colon to allow me to poop every day? Okay, do I need to take some supplements? Do I need to have visceral mobilization done so I can help my organs move normally and get back into the normal places? Do I need to work on my hip mobility so my rectum isn't kinked in a certain direction? Or is it posture and breathing? So these are the things a pelvic expert physical therapist is going to be like absolutely essential in helping you get regular on your bowel movements so you can decrease your pelvic pressure. So that's decreasing intra-abdominal pressure. But we're going to talk about that later. That was mainly about making sure your bowels are in control. So breath patterns. Breath patterns are absolutely essential for maintaining the pressure as well. So breathing, the way to do it is to do some diaphragmatic breathing to start. When you take a diaphragmatic breath or a deep inhale, what happens, and a lot of people are scared to do this if they have a prolapse, but what happens, so if you put a hand on your belly, you take a deep breath into your bottom hand that's on your belly. Maybe let your ribs expand a little bit. Keeping your chest kind of quiet so you're not sucking up the air all up high. So you're letting your bottom hand expand and then exhaling. When you're doing that kind of stuff, that kind of breathing, the diaphragmatic breathing, what happens when the diaphragm goes down and expands is that your pelvic floor goes down and expands. So even though breathing is a great exercise, it is an amazing pelvic floor exercise because you're getting that relaxation. And earlier I talked about why it's so important to have that relaxation so you're not living in this position. So using your breath patterns is essential and the starting block for returning to the gym. So 5 minutes of breathing a day, super good. Even driving in your car, take a deep breath, see if you can feel your vagina open, feel your anus open, try and connect down there so you know that you're not just walking around in this contracted state. So you know you're not just squeezing your buttocks, because if you're squeezing your buttocks when you're standing places or sitting, you're going to be contracting everything. And we don't want that, right? So your pelvic floor contracts when your buttocks contract. So we want those to relax. Okay, so core coordination. So we won't take this. I'm going to talk about this a little bit more, on the next page, because it's going to be one of the tips I give you to return back to the gym. But the core coordination here, so the bottom that you see is the pelvic floor. This is a side view. The side muscle is called your transverse abdominis, and the top is your diaphragm. And these work in coordination to manage your intra-abdominal pressure. And pretty much alone, these muscles determine how strong your core is. So when your foot hits the ground, you should get some recoil, some reaction where your pelvic floor contracts, your belly contracts, and your diaphragm is strong. And so you have a good pressure inside that system that's absorbing the forces. But if your pelvic floor is super tight, every time your foot hits the ground, a lot of times your joints are the ones that take that up. So we end up with things like back pain, hip pain, knee pain, and different kinds of pains in our joints just because our core isn't helping us absorb these forces. And so it's really important that you learn how to coordinate your core. A pelvic expert PT is the one to teach you how to do this because you really want to know what's happening on these deep layers of the pelvic floor. And so the pelvic floor is 3 layers. And that's why it's really important that you don't just have biofeedback done externally. You want to know what's happening on every level of the pelvic floor and the muscles. Okay, strength. So once you develop foundations with a pelvic expert physical therapist, then you can start training however you want. And really, there's no limits to training with a pelvic organ prolapse. You can deadlift 500 pounds. You can squat a couple hundred pounds. There's truly no limits. It's just managing your intra-abdominal pressure, making sure your hips are strong, making sure your pelvic floor is dynamic. So what we typically see, so that's why working with a pelvic expert PT is like so absolutely important, because they can see what's happening to you as you go back to training and as you continue to train. When people, usually postpartum, like before you go back to your exercise routine, we'll see people and we're like, things don't look too bad. Or especially if they came during pregnancy, we're like, you're fully healed. Like this looks really good. Let's just start getting back to your exercises and see what happens to your organs, making sure they know how to manage everything. But if they weren't working with us during pregnancy, there might be more descent and more scar tissue. that we'll have to work through before we can really go back to training. But what we see is that really at that 8-month mark, 8 months to 18 months, when people start to want to get in shape again, or have that, I want another baby and I want to get in shape first, they will come back to us and notice things are not right or not fully good. And the reason for that is because they didn't have these techniques as they went to their training program. So even if they didn't have a prolapse or things felt really good postpartum initially, the minute they went back to training, or exercise or whatever group fitness or lifting routine they were doing, the minute they shifted back into that, that's when things started to get worse, or they started to feel really symptomatic, with heaviness, pressure, something's falling out of my vagina. And that's the most common story that we hear. And so, that's why it's essential to have a pelvic PT on your team. And really, the reason that we usually work with people on they come in once a month as postpartum, because your hormones change so much within that first 18 months of the baby, that once they are done with their initial phase of healing, they'll come back once a month to make sure that organs stay in place, make sure that if things are getting tight again, that we know how to relax them, or they need help relaxing them, make sure we keep the organs dynamic and mobile so we can keep the pelvic pressure down, so we can keep our poops good. So even though things you might have seen a pelvic expert PT, you have to keep with it, right? Like, especially as you up your training or change your lifestyle or whatever it is for you. Okay, so these are the exact 3 things. This is why you're here today. It is important for me to give you those backgrounds so you know that, you know what I'm talking about. But these are the exact 3 things that you want to be able to do or have mastered before jumping into your gym routine. But I honestly challenge everyone that ever watches this to think that these are the exact routines that you should actually just be like implementing to your life ever and for always, because regardless of whether you've had kids or not, you want your organs to always stay inside your body. You don't want to have incontinence. And unfortunately, in our society, if you go into any assisted living facility, my experience as working with as a PT in that setting is every single woman is incontinent. And I think part of the reason is because they just never learned how to keep their organs inside their body. And you think that's natural, but it's not. We do a lot of things like lifting, and our mechanics never stay good for our entire life unless you're trained in how to mechanically stay sound, right? That's why we have knee replacements, hip replacements, people hurt their backs, lifestyles that put extra stress on different parts of your body. Same thing with your pelvic floor. So 3 things that you want to be able to do. The number 1 we talked about was diaphragmatic breathing. Do that 5 minutes a day. But once you've gained the ability to diaphragmatic breathe, that is going to be more essential in getting you back to the gym safely for the rest of your life than any other move that you can think of. So the reason I say this is because if you inhale and then you exhale, you're going to get the recoil of your pelvic floor. Okay. Just naturally, that's what happens. So inhale, if your diaphragm descends into your belly, your pelvic floor is going to descend. As you exhale, you're going to get some contraction. You should not ever have to think about Kegling, even if you're deadlifting, even if you're lifting your baby, whatever it is for you. Okay. So the number 1 thing, let's take lifting, for example, because I think everyone does some degree of lifting, even if it's a car seat, even if it's pulling something out of the cupboard that's heavy, or reaching overhead if it's heavy. Okay. So when you go to lift or do anything, any exertion, even if I was going from sitting to standing here, your natural movement should not be to hold your breath here. Okay. Because if I hold my breath and I stand up, there's going to be more pressure in my belly, and therefore more pressure down onto my pelvic organs that is going to potentially push things out. Okay. So you'll use your breath anytime you move. Okay. So if I go from sitting to standing, exhaling is the magic here. So you're here, inhale, exhale as you leave. I know my pelvic floor is recoiling when I stand up. Okay. It could be the same for doing a wall sit. If I'm I want to make sure that I'm breathing. Now, if you are going back to running, there's no way that you should be Kegling the entire run. You should not be Kegling the entire walk. That is not a thing, and that should never, ever be a goal, okay? And the reason for that is you want this dynamic movement to happen within the pelvic floor. Every time your foot hits the ground, there should be a little shock absorption movement. And so you have to make sure that when you're on your runs, you're actually breathing and you're not thinking about just holding a Kegel for the entire run. That's not feasible. And that will just put you in this tone pattern. So whatever exercise you're doing, exhaling with exertion is going to help decrease the pressure. Even if you're going from, down dog or into cobra. Okay. So going from down dog. So if we're all familiar with those movements, if you go from down dog to cobra, that takes some upper body strength. And as you do that strength exertion movement, you're going to exhale through that to help decrease the pressure on the pelvic organs. Okay. The next thing that we talked about is your bowels. So we want to keep those empty and make sure that you try, like, if you know when you're going to start returning to the gym, say you get 9 o'clock or 9:30 every single day, or, a couple days a week, that's when you have a babysitter or whatever time of day you work out. You want to try to have a bowel movement before you do that workout. And so you want to get regular at that time of day. So I work out at 5 a.m. I have to wake up at 4:30 to make sure that I can have my bowel movement on the days before I lift weights. So I'm not lifting weights and having to hold up more stool. Okay. So it's important for me in my prolapse that I can evacuate my bowels and be empty before going to the gym or before lifting. So I can keep everything up and in. So hopefully that makes sense. A pelvic expert PT can help you get really regular on your bowels, so you have that kind of control. And then the colon is so smart. So if you're used to holding your poop in, it's going to be like, okay, we'll do this for you forever. And you're kind of going to lose that reflex of what the colon gives you. And so it's important that you listen to your colon every time you get an urge to defecate or have a poop. And so with that being said, just work with a pelvic expert PT to help get those poops super regular, so you can kind of control what your pelvic pressure is doing when you go to return to the gym. The third thing, so these are the top 3 things, and then I have a couple more tips. So it was breathing, that exertion, breathing, exhaling with exertion. The second thing was having those regular bowel movements, trying to evacuate your bowels and your colon before you do your exercise. And then learning how to use your TA to lift your bladder. Okay. So here we go. I'm going to demonstrate here. I'm going to turn. So if you can see me here, maybe that's not great. Here we go. Okay. So here's my TA. So underneath my sweatshirt, let's just show you belly straight up. This is a belly of 3 kids. Okay. So here's belly. Lots of skin and fat that I love so much. Okay. So you're going to, if I just was going to engage my TA, and this is what we see really commonly, engaging TA looks like this. Okay. So tightening of the belly. A lot of people will just brace their core and pull everything up and in. Okay. To tighten. So if you're here and then you pull up and in to tighten, you have the risk of pushing the bladder down, pushing the pelvic organs down because of how you tighten. So you want to make sure that when you contract the TA, that you're getting an upward lift here. There's a little ligament that goes from the bladder to the umbilicus, the belly button. And if you get that TA contracted, you are going to get a nice little lift of the bladder. Okay, so the way that we like to teach it here, to contract that TA, and butt should be relaxed as you do this. So keep your butt flabby and floppy. Okay, so as you do this, that is going to ensure, if you do the SH sound, that will ensure you get this nice little lift. You could practice this at home and have, just in the privacy of your own room, feel what's happening inside the vagina. Do you feel it elevate when you go shh, or do you feel more pressure in bearing down? And a lot of times what we see is that when we start to do TAs with people, we'll have to make sure that their TA is lifting and not pushing down. Okay, so if I'm here you see the same thing. So I'm here and you should see that upward movement. Okay. So underneath that nice little layer there. Okay. So that was lifting the bladder, using the TA to lift the bladder and not just doing a full on, tightening abdominal brace. That's really important. Okay. A couple other things to keep in mind. So these are my maternity pants and I love them still because they're so loosey goosey, but I have some really fun, like new tighter pants. And if you wear tight yoga pants and it is above your pubic bone, okay, so pubic bone is down here. So kind of like your underwear line, unless you wear really high underwear. So if it's at your underwear line, you are okay if you're wearing tight pants. If you wear tight, high-waisted pants, which is really common nowadays, and they're really tight, that can push in and push down, okay? So that could increase your pelvic pressure. And so it is really important that if you are going to engage in wearing those tight, high-waisted yoga pants, that you scoop your bladder up. So that would be right above pubic bone. I'm kind of flashing you. Right above pubic bone, you sink up and in, and then you just kind of pull up the bladder and then put your tight yoga pants on. You kind of want your bladder to stay in that lifted position because that's going to decrease the pressure down on the pelvic floor. Okay, so just something to keep in mind. The next thing that you want to do, and I'm going to give a demo of this here. This would be nice to do barefoot. So if you do it barefoot, you're going to activate your pelvic floor more, but I'm going to show you with my shoes on just for the sake of being at my office and being easier. But if you're doing it barefoot, you're going to stand on one leg. You can reach this leg back, kind of like if you're going to warrior 1 or warrior 3, and then just bring this leg up. You're going to start to feel that standing glute. And as I come here, I come up and I exhale, keeping my TA turned on, decreasing my pelvic pressure. And you might not be able to start there. You might have to start more of a kickstand place. And the reason we're doing this is to start strengthening the hips, because the hips, when they get strong, they're going to help keep the organs in a good place and decrease that pressure out of the vaginal canal. So let's see if you can see my feet if I do it this way. So if I'm here, so if we modified that and I just wanted to do maybe a kickstand position, I could stick my butt out. And this is a modified single leg deadlift. I'm here, and then that could be one. You could put a weight in this hand and then if you felt any pressure at all in your pelvic organ prolapse, you would just make sure you're engaging your lats as you do this. So you can kind of, if you had a weight, you would just like hold that weight close to your body, pull your shoulder blades down and back. So let's do that move together. Kickstand. This butt cheek goes back, pulling the shoulder blades down and back, and then exhaling, coming up and in, okay? If this is symptomatic on your prolapse, you want to keep an eye on it. You want to talk to your pelvic expert PT, figure out if your bladder and your colon, everything is staying in place, all your organs, and make sure that's right for you. So I hope that makes sense there. The next thing I'm going to show you here, and this is one of my favorite things to do. This is what I did after my second kid, returning to running. I haven't returned to running yet right now because I'm just not loving it. Maybe when the summer comes around, I'll want to run again. Or I ran one time, I guess, and I talked about it on YouTube, so you can find it there. But really, if you're going to start a running routine, or you know you have a pelvic organ prolapse and you want to start a running routine, or any impact, okay? This could be plyometrics, jumping, going to CrossFit, something that's more ballistic, so moving fast. You want to think about maybe supporting your bladder a little bit more. And you can do this internally or externally. Internally would be with the pessary. We can always talk about that. And maybe I'll do another episode on pessaries. But today I'm going to just talk about repositioning your bladder with KT tape, okay? Or kinesio tape. You're going to take a piece about this big, and you might need 2 pieces, but you can play with that yourself. I rip the tape in the middle, and here is how I tape myself. So I hope you can see me here. I'm going to lay on the ground, that table. Okay. And then I'm going to show you my belly. And we're going to go right above pubic bone again. So the reason we do that, right, is because the bladder lives right behind the pubic bone. So I'm gonna have to bring my pants down just a little bit more. Okay, then I cut the tape in the middle, or I rip the tape in the middle, the backing. So I'm gonna, if the tape stretches 100%, I'm gonna stretch the tape like 20%. That's just relative, right? Just see what you kind of do. Maybe no stretch at all, even for this first little piece. Okay, so then I put the tape right above my pubic bone. Then with this hand, I lift up bladder. And with this hand, I'm going to pull the tape. Okay, I'm using like 75% of the stretch in the tape, pulling 75%. And then at the last inch of the tape, I'm not going to pull it all, and I just lay it down flat. Same thing on this side. Okay, so I'm going to lift up the bladder with this hand now. And then I bring this piece of tape. Okay, and I pull it, and I'm lifting here. Oops. Whatever happened to my tape. Okay, there we go. And then I just lay it down flat. Okay, so now I have this tape that's lifting my bladder up, and I can do some TAs to check it. I can, okay, yeah, I can feel some elevation there and let it go. And you can do that. You might feel a Kegel, but really all we're going for with that movement right here is just to activate that TA and lift the bladder. Okay, so and let it go. So that is what it looks like. I'll show you what it looks like in standing. So let's see if you can see it here. Full on belly view. And you can see underneath my belly, my tape is lifting up my bladder very nicely. And then I'll just pull my pants up and bring my shirt over to my tank top, and we're good to go. My bladder is lifted and I can go to my exercise. And you might feel relief, you might not, but this is a good technique to play with to see if it helps you return to your exercises. So these are the 3 things you need to master. We talked about the breathing, exhaling as you do anything with exertion. We talked about having really good bowel movements. And then we talked about using your TA to lift the bladder. And then of course we talked about the tight pants, keeping your hips strong, and then repositioning bladder with KT tape. So, oh, I didn't add the bridge. The other move you can do to help shift the bladder up and in. So before you go for a run or before you do your workout is to do about 10 bridges, just shifting and lifting and shaking your hips up to help bring those organs up into place. That can be a fun way to do it. So there's that. I have a book where I talk more about pelvic organ prolapse, and that's called Restore Your Body After Kids, The Secret to Avoid Peeing Your Pants and Achy Joints as You Age. So I hope you will check that book out. It's available on Amazon. If you want to come in for a free discovery visit, we reserve that really truly if you like you're serious about getting better and wanting to really help your prolapse. We have a pretty hefty wait list right now. So we just want to take only serious people right now that we can truly help. Some people travel here from different areas and different states to get treatment, and we do intensives. So if you are out of state and you want to travel here, we're happy to help you or do some virtual visits to start. Okay, I hope this was helpful, and please feel free to reach out at support@bodymotionpt.com, and we will get back to you. Take care, guys.